Welcome to the third of our Mondays in March presentations for 2016. I know Ms. Sollenberger has a very nice presentation to provide today, but before we get started with that, just a reminder of Ms. Sadro's major points, at least as we interpreted them. Number one, we're doing okay financially. We've known for a long time that this particular period, this fiscal year and the next one, are going to be pretty tough, challenging just because of the combination of the last remaining Ike expenditures, the big depreciation hit from bringing on all the new facilities, including those associated with Ike, and the opening, the wind-up of our two new facilities. But we're doing okay. We're on target right now. We just need to continue to watch what we're doing, control our expenses, and pursue our plans to produce revenue as we created them in the past. A lot of moving parts right now relative to the markets in which we compete for patients. I'm sure Ms. Sollenberger may talk a little bit more about that today, but this shift from the fee-for-service approach that we've used for years and years and years to this concept called population health management, as that hits, as it comes into play, we're not going to be paid on a per procedure or per intervention basis. Instead, we'll be paid for taking care of the holistic needs of the patients. So by diagnosis, for example, if the patient has hypertension and diabetes, we'll be paid to provide all of the care that the patient needs over a defined period of time. And so making that shift is a bit challenging. We have a foot in one world and a foot in the other right now, but we continue to work to develop the infrastructure that's going to be necessary to help us compete effectively in the future, while at the same time continuing to try to meet the growing demand for our services from patients. A lot of things associated with developing that infrastructure. Ms. Sadro spent some time talking about predictive analytics or big data, and what we're doing on that front relative to an enterprise data warehouse, some of the great work that's already been done, some of the effort to use a contractor to come in and help us move some of our efforts along and bring some new analytical tool sets that we think we'll need. So a nice update relative to where we stand provided by her last week. Also thinking about how we best use the space that we have, the resources that we have, continuing to look at how we apply what we have to our current plans as well as plans for the future. So some discussion of that. So bottom line, the pace of change continues to grow more quickly, but we have strong plans and we're essentially on plan for the most part. So we just want to continue to do what we've been doing and continue to keep our eyes peeled, if you will, relative to the coming changes in the marketplace. So with that said, we'll ask Ms. Sollenberger to come up and talk about the health system.
2, 1, 0, all engine running. Liftoff, we have a liftoff, 32 minutes past the hour. Liftoff on Apollo 11. Okay, engine stop. Houston, Tranquility Base here. The Eagle has landed. Roger, Tranquility. We copy you on the ground. You got a bunch of guys about to turn blue. We're breathing again. Thanks a lot. Okay, Neil, we can see you coming down the ladder now. I'm at the foot of the ladder. The limb footpads are only depressed in the surface about 1 or 2 inches. I'm going to step off the limb now. That's one small step for man, one giant leap for mankind.
think we ought to thank Mary Feldhusen for helping me out there. I'm Donna Sollenberger, if you don't know me yet. This is my 7th Mondays in March. How many of you, is this your first Mondays in March? Anybody here? Oh, Tamika, and there's a gentleman in the back. Great. Well, I hope that you enjoy this. The purpose of the Mondays in March is to really not only celebrate what we've accomplished since last March, but also to focus on what it is that we really need to be accomplishing as we go forward. The accomplishments are many since last March. We'll talk about a few toward the end. But to help you, there was a handout, a one-page handout that many of you have, and that really focuses on the accomplishments. It says health system, but actually none of those accomplishments are possible without great teamwork from across the organization. I see people like Todd Leach, Ron McKinley, Jake Wolf. I see people from all parts of the organization, Dr. Jacobs here, Dr. La Posada. None of these things that we will talk about will we be able to accomplish on our own. We need help from across the organization. And we have accomplished those many wonderful things that you see there because we have had a lot of assistance. Today we're going to talk about 4 quantum leaps. Quantum leaps that we need to make in quality, in service and transparency, in efficiency, and in investing in your future. Now, Chancellor McRaven has developed and presented to the Board of Regents his vision for the future. And his vision for the future focused on quantum leaps. And there were 8 that he really emphasized, and these are available if any of us are interested, and I think that they're worth reading. There's a summary, and it doesn't take a long time to go through it. But I think it helps me to connect back to what are the things we're doing that really are part of the UT system vision. And then what's our vision here? What's our plan? What do we call it at UTMB? The road ahead, right. And so we have tried to link what we're going to talk about going forward today to the road ahead. So really, if you think about it, what I'm going to present to you today and the work that we need to do reinforces the road ahead, which is the strategic plan for UTMB, and that reinforces the quantum leaps that Chancellor McRaven has asked us to do. So you'll start seeing some tie-ins, and I hope as you see other things and initiatives that are going on or things that you want to start within your own areas to think about how does that link to the road ahead, and how will that then link back to the quantum leaps that Chancellor McRaven has discussed. So the first one we're going to talk about is a quantum leap in quality. Chancellor McRaven challenged Dr. Callender to challenge us that we have a quantum leap in quality so that UTMB achieves being a top 20 academic medical center as measured by the former UHC, University Health Systems Consortium, now Vizient, as measured by their quality and accountability study, and that we need to do that by August 31st of 2017. Now, Dr. Callender in his town halls always reminds us that our vision at UTMB is to be the best at whatever we're doing. Now, when Dr. Callender told me that this was the Chancellor's vision and therefore our vision too, I took a bit of a gulp because you're going to see we've been working on this for a while and haven't really even made a jump too much, let alone a leap. But as I went home and I thought about it some more, I started thinking about what if a patient were sitting in front of me and said, where are you in quality? When you stack up against other academic medical centers, where do you sit? What's your place? And I thought, that's really how we have to frame this. It isn't an option. It really is our commitment to our patients to be the best. And to really move into that top 20 puts us in great company with people who have already been measured to be the best? And who among us is able to say, it's okay to be number 63? No, it's not. And so we want to be able to tell our patients, we are the best, and here's how we're measuring that. So this quantum leap, although daunting, makes a lot of sense. Now, Ms. Sadro talked last time about the triple aim, and it's part of any work we do in quality. And it's really an aim for excellence, whether it's better health or the outcomes for that, better care, the processes by which we care for patients that are patient-centered, reliable, accessible, and safe, and affordable care. So if we think about that, and think about the triple aim as we talk about the various leaps that we're going to make during the next 12 months. So where are we now? Well, this was just my assessment. We're number 58 out of about 110 or so that academic medical centers that report. So this is my view of where we are. We're kind of solidly stuck in the middle at 63.4%. Not bad, certainly not great. So what we want to do is try to focus on those things that will help us improve in the areas where we need to have the most improvement and that will make a difference, have the best chance to make a difference for our patients. That circle I thought was a little bit hard to figure out of equity, efficiency, and so forth, where we sat relative to number 20. So if you look at the green line here, anything to your right is really the top 20. Anything to your left is below the top 20. The green line is our goal. So look at the things that I have circled: mortality, effectiveness, and efficiency. Those three items, if we could really make vast improvement in the care for patients, those are the three things where we would be able to truly make a difference and move on up into that top 20 rank. And so we're going to talk a little bit about those. So one of the things that Mark Kirschbaum always tells me is that we have to have reliable care processes. Without reliability, without predictability, we are never going to make that quantum leap. So how do you get reliability in an organization? What's essential for it? Well, leadership is commitment from the top to say that this is going to be important work. And so not only do you have commitment from Dr. Callender, Dr. Jacobs, Ms. Sadro, and myself that this is going to be important work that we have to accomplish, we also have named leaders for our unit-based clinical leadership, that's that acronym there, and our ambulatory-based clinical leadership. These are physicians who have agreed to be medical directors, either in clinics or in units, to help us really have better work on behalf of our patients. So those champions, those leaders, along with our chairs and our vice chairs, are really committed to making sure that we make those leaps. We also need to measure, audit, and report on how we're doing. So we have to set targets, and we've got targets set. You can top 20, and then there are ways that we do that. And then we need to say, as we go through the process, how are we doing? Are we making progress? If we are, let's celebrate that and ask if we can replicate it elsewhere to accelerate the work. If we aren't, what is it that's not helping? Also, leader rounding, and I see a number of our nurse leaders here. I saw Christine Wade over there from the emergency department. I saw Barb Bonificio, David Marshall is here. Anne is here. So we're talking about leadership rounding, going and talking to our patients and being visible and asking our patients, how are things going? What could we do better? And being able to act on that in real time. Because if we're going to make a difference, waiting for a month or two till we get the report that says how we're doing, what are we doing? Are we looking ahead? No, we're looking at things that have already happened. So leader rounding is very important because it can help us identify things that are happening real time that we need to intervene with and fix. We also need to be patient-centered. I don't know how many times in the process that we've gone through in building the Jenny Seeley Hospital have we been stuck on something. It's like we can't get an answer, and we're all have a different point of view. But when we ask the question, what would the patient want, it came into focus, just like it did when Dr. Callender said we have to be in the top 20, and I'm ready to whine, and then I think, if I think about the patient, I want to be the best. I want to actually be number one. So having the patient always at the center of our decisions, whether you work in the structure of the health system or not, becomes critical to making decisions that are in the best interest of our patients, which many of us touch in many different ways. To have reliable care processes, you also have to have a safety culture. How many of you have used the patient safety net reporting system? How many of you have heard about it? Yeah, okay. People fill it out when they feel safe. Does that make sense? They fill out where a problem occurred, a mistake happened, or even better, something could happen. I see it, hasn't happened yet, but I report it so we can fix it before anyone gets hurt. But if people fear filling those out, that someone will be upset with them, that someone will find out they filled it out and be negative to them, they aren't going to fill it out. And one of the things we had this year, I don't know if I didn't see Tom Blackwell, he's the head of our GME programs. We had a site visit from a group that looks at our clinical learning environment for our residents. And they were interviewed, many of our residents were interviewed, and the number one reason they didn't complete a patient, well, there were a number of reasons, but one of the top reasons for them not completing the patient safety net was they feared if their attending found out, they'd be in trouble. We have to wipe that out. It needs to go out the window. And again, thinking about the patient safety net, if we really are going to catch something before we hurt someone, it's critical that we use those systems. It's a one way that we can tell that we are not doing well and get it quickly to leadership. Those are looked at every time one comes in of a certain number or above, they're looked at immediately. So I hope that you aren't in an environment where you fear that if you step forward to do the right thing, that somehow you'll be retaliated against. If you are, we need to understand that, because that is not the environment that's going to get us into the top 20. And then there's also a culture of tolerance. We have been working for, I think it's 4 years now, on hand hygiene. And I never knew how tough it was to do what your mom just always told you to do before dinner, wash your hands. But it's tough, and there are lots of reasons. Some of them are, things are going fast, and you're trying to save somebody's life, and that just doesn't happen that moment. But by and large, we should be able to do that. But if we tolerate that going on, if we aren't able to remind someone, oh, you might want to gel in, or why don't you gel out? If you have a fear of retaliation, the first bullet, not going to happen probably. So we need to create an environment where we are all coaching each other, talking to each other about what we can do with that patient at the center. And then we have to have good improvement systems, lean, PDSA can be Plan, Do, Study Act, sometimes Plan, Do, Check Act, PDSA, and then the clinical safety and effectiveness courses. Has anyone in here taken a CS&E course? Yeah, they're really good in that they help you learn how to use tools to make improvements in your own areas. And then we have to hardwire it to sustain the results. Lots of times we'll get the results we wanted, and then, we kind of look away and you see this start to happen. So we need to make sure when we make those improvements, we have worked to make sure that they are hardwired, they become part of what we naturally do. So how can we reach this top 20? Well, highly reliable organizations have 5 characteristics. They're sensitive to operations. They think about them. They think about the process and how that's going to affect the patient. They think about the staff in the process and are we using them to the top of their license, doing meaningful work that would suggest that they are doing the work that they were trained to do. Also, highly reliable organizations don't accept simple explanations for problems. If there's a problem, they look to make sure that they're fixing the problem, not the symptom. And so that's that sort of root cause analysis. What's really happening here that's causing the system to fail? They are preoccupied with failure. Just like I said, we need to make sure that we do the best that we can for our patients. And so sometimes thinking about we need to make sure that the system doesn't fail is as important as making sure that we're being happy that we're always doing things right. So when we have these incident reports, we get on them, we start working, and we make sure that those things are taken care of. Those people with the expertise are deferred to because they're the experts. We do listen. It doesn't mean we can't challenge. I mean, a lot of times my intuition, even though I'm not the expert, would say, I wonder why that is. If only to educate it, to be able to question, to ask, to make sure that we're getting the best decision, but those who are the experts should be leading that particular issue. And then the one thing we all know UTMB is, and that's resilient, that even in spite of seeming failure or an incident occurring, we can bounce back and we can get over it and actually make the system better for our patients. We talked a lot in our leadership group about how can we do this? There's so much going on. And we decided the way that we can do it is to focus on those things that if we made a vast improvement, it would most benefit our patients and would show then in our results to get us to this top 20. Because the goal is really not to be in the top 20. The goal is to take really good care of our patients, and the outgrowth of that will be in that top 20. So we want to focus our work initially on mortality and effectiveness. And that study I've talked to you about breaks down where you have the most opportunity to improve. So those departments and divisions or services, if you will, are not because they're doing a bad job. It just means there's more opportunity that we can look at and try and focus on how can we improve care for patients in those areas. Effectiveness, if we just focus on 30-day readmissions, that and focusing on length of stay, and we will vault right to the top. And again, good for patients. If you look, though, our improvement over the last 3 years is 1.9%. Have any of you seen the movie Zootopia? I have a grandchild. And we went to see it, and there's this, sounds silly, this bunny, and she's become a policeman. And she's trying to track down a license plate. This sounds like a kid's movie, doesn't it? And she's trying to track down a license plate, goes to the DMV, and cracked the whole audience up because the people that they were characterizing them as were sloths. So they move very slowly. Well, we don't want to be like that in healthcare, especially at UTMB. We want to be quick, but we want to be accurate. We also can reach that top 20 performance by using the patient safety net, but how many of you who've used it think it's pretty complicated to use? Okay, good. We've got some people willing to tell us like it is. So we need to make sure that we improve the whole process. Some of you have said, we don't know where it goes, it's a black hole. Making sure we have consistent feedback loops. We've received your occurrence report. Thank you very much. A lot of times, we can't tell you exactly what happened. I mean, it's protected information, but we can tell you that we have completed our review, and thank you for bringing that matter to our attention, so that we are going to look to have a better way of letting you know that you were heard and that we looked at it and we have closed the case, which means those things that need to be taken care of have been. And so that's that feedback loop. We can also focus on why is this important? Why would it be important to be, in the top 20 for mortality? Well, obviously, the most important one, it saves lives, but it also reduces preventable complications that add cost and length of stay, which has cost inherent in it, to an organization. And it also helps to minimize our financial losses, because as we go forward in this value-based purchasing for health care, Medicare will give us penalties for not reaching certain thresholds for performance in mortality or in patient satisfaction. And so goes Medicare in the states, so goes Medicaid, and you think about Medicaid being such a large payer here. Those numbers that you see there are numbers that, because we did not perform at the level that CMS set, we actually lost some money. And this isn't little amounts of money. I mean, I'd love to have those back to help balance the budget. So these are real things that are happening now that cause us to really want to focus on this. So our takeaway messages, we do our work in teams, we focus on the work. So sometimes if you ask in the coming year, you want da-da-da-da-da done, and we say, we hear you, we're going to put that in a queue, but we need to finish this other work first. So we're not going to be able to maybe be as immediately responsive to what you want, but we are going to be very responsive to what our patients want. And then a blameless culture, hardwiring for success. We have to do this work to be the best. So our next quantum leap is in service and transparency. And we have some service standards that Martha Levonick and her team, I don't know if I saw Martha. Are you here, Martha? Ah, there's Martha. She said she's so tall. Martha, and with Mark's help and many other people, worked on some service standards that we're beginning to roll out. And the bottom line is we want to create a memorable experience for all our patients and guests. So we're going to begin by greeting and assisting our patients and guests. We're going to, when necessary, guide them to their destination. Has anyone helped walk somebody either from Jenny over to John or vice versa already? And it's not even open, so we've had lots of opportunities. It's a little bit complicated, people will think right now, so we need to be able to stop and guide them. I know I have been late to some meetings because I have taken someone where they need to go, and I'm sure it's the same for you. But this is a big place, and it's daunting for our patients and visitors. So if we are really going to be in tune with them and thinking of them, we need to help them get to where they need to be. We're also going to keep UTMB beautiful. If any of you are missing your ponytail holder, I just threw it in the trash a little bit ago on the way here because it was on the floor and I was afraid somebody would slip on it. But we need to be looking at our environment and reporting things that we can't fix and picking up things and then using the gel dispensers, picking things up and doing away with them and then gelling. And we have to demonstrate our values. We have to live them, both for our patients and families, but also for each other, showing compassion, respect for each other, integrity, diversity, and lifelong learning. That's what we ground our work in. So what do patients want? And I'm going to ask you this because we're entering this age of consumerism, where consumers get to make choices that in the past they didn't either get to make or have to make. But they want, and this was from a study, they want the best health care. So they define it as highly qualified and experienced, reliable, and recommended by people I know. They want treatment that works. They want timely care. They want to be treated with kindness, hope, and certainty about what you are telling me. It may not be good news, but let's be certain it's the right news. They want continuity, choice, and coordination of care. They don't want to have 8 doctors come in and they still have no idea what the plan is. They want privacy and respect, and they want low out-of-pocket costs. And so if you think about it, and we talked about this, I think, the last couple of years, they want the best possible care at the lowest cost. And while that may seem somewhat mutually exclusive, we have found that good care that has no complications, length of stay is just right, actually is cheaper care. So that's why we're going to focus on some of those, because our customers are telling us that's what they want. They require us to be patient-centered. They want how we talk to them, simple and understandable language, not jargon. I think actually we do a pretty nice job of that. I've been through and heard different residents or physicians explaining to patients certain things, and they do it very, very well for the most part, but we still have to keep focused on these are not healthcare professionals by and large, they're patients, so we have to break down what we're telling them into things they can understand. And they want us to be transparent with our performance. How many of you know that today you can go onto the UTMB website and find the patient satisfaction scores for each of our physicians? Yeah, that's that transparency initiative, and we're going to be rolling. We have more. We have our publicly reported data there. So we want patients to be able to come to us to see how we're doing, as opposed to rely on some of these others like Yelp, which doesn't have, it's just whoever yelped the loudest usually. Health grades, vitals, and so forth. So this is what consumerism is going to require. And the top one is expertise. They don't want us to have a history of medical errors. That's important to them. They want us to be courteous and so forth. And even food and parking are important. Sometimes you'd think they were number one, but they aren't. But it does make a difference to some folks. Now, the first one's history of medical errors, expertise. How do they judge that? And it's hard. Think about your own. I have a family member who happens to have been admitted to the hospital over the weekend, and I was talking to their family because there's been an error involved that the family knew about. But one of the things I talked to them about was something they would have never thought of, that they needed to try to make sure they were focusing on. But by and large, patients don't know how to judge quality. They don't really even always know what those transparent websites mean. So they're basing their assessment of our quality on how do we treat them, what's the cost I have to pay myself, how courteous are people to me, is it close to where I live? I don't want to have to drive long distances except in really extreme health, with extremely difficult health issues. And what are the amenities? I mean, if you think about it, that's what people know. That's how they know how to judge us. It's not that Dr. La Posada can do a coag test and be able to make sure that that surgery goes well by putting us on XYZ drug or taking us off of XYZ drug. They don't know any of that, but they know when it doesn't happen. So this is that experience that they judge us by. And then I just wanted to highlight a few things that we've done to try to improve our service and transparency in the last year. There's been a lot of talk about MyChart. We had over 3,400 appointments last year for our established patients, 3,400 appointments scheduled on MyChart. We added 832 same-day slots for general medicine, eye-and-ear, and some others, with almost 100% usage of those additional slots because we were having access issues. And folks got together and figured out how they could do this. We have instituted a Just Say Yes program. We've got some work to do. I don't think it's at 100%, just say yes. but Ann's smiling, and she knows, she and Dr. McCollum know this is important work that needs to be done. We've increased the number of advanced practitioners to help us with access too. If I just say I have a lower backache and I want to see the orthopedic surgeon, how will I get to the right one? Do I really need a surgeon? Could I really use PT? So advanced practitioners is like that first screen are able to help us, and they've been a big help there. And then we've answered 90% of all my chart messages within 48 hours, and the other 10% have called either Dr. Calendar or me when that didn't happen. So, but we do need to get that closer to 100. We know that, but those are the kinds of things that are going to be important for us to work on. I saw Dr. Walzer here. There he is, up there in the middle. We said we were having trouble getting patients in for MRIs to our League City campus, and we got together. We had folks look at what the issue was, and they decided to expand hours, and they created 1,820 new exam openings annually. So they now are open on Sundays. They've extended hours Monday through Friday till 9 p.m. There's a dedicated phone line to get an MRI scheduled, and they've hired a person in radiology to help on the other end when the PSS calls actually schedule that. It's a difficult test sometimes to schedule correctly, and so these are interventions we have done to make sure that we were able to open up our access to MRI at League City. We have a lot of work planned for the future. Few are expanding our urgent care service sites, working with the departments to help tackle that difficult no-show problem, where in some of our clinics we have a 20% no-show rate. That's 20% of appointments where no one comes and we're staffed to take care of patients. So that's something that, patients could really use to be able to get into those slots. We are going to do many different things that you see here, but in the end, we want to collaborate, that teamwork on access, so that we can be the very best. Quantum leap in efficiency. What will the future at UTMB look like? I don't know if all those folks on the right are always going to be here, but they're here now. But I did that because it requires leadership to help you look at where can we go, where are we going. And we need to do a good job of trying to help you understand that. So in the future, I went back to a presentation for Mondays in March. I think it was 3 Mondays in March ago. I think it was Dr. Jacobs' first Monday in March when we were looking at the future, and he talked about AE 2020. I talked about what we'd look like in the future. I pulled some of the things we said that we were going to be, a top performer in value. And here we are 3 years later saying, okay, this time we really mean it. We're going to do that and get there in the next 18 months. Relentless pursuit of excellence. We aren't happy with the status quo. We as leaders understand the issues and hold ourselves accountable. We have data easily available, accurate and transparent, which is why when you heard Ms. Sadro talk about the enterprise data warehouse, why that was so important. We're all looking for data. We're all kind of complaining that, well, we're not getting that, or we're not getting that fast enough, or we're getting it and it's not accurate, or we asked for it and got 3 different numbers. That's why that work is so important, because we have to be able to access good, reliable data quickly in many instances. And so these are the things that we want to try to emphasize. We say that decisions are easy to reach in the future. We've heard sometimes from you, you don't think that's so much the case. And so we as leaders need to do a better job of that. So as I was looking through what we need to do, there's a lot the leadership needs to do and a lot you need to do, and working together, we will be able to ultimately be the very best. How are we going to improve efficiency? Well, we know that efficiency is really going to come when we get the greatest value, highest quality at the lowest cost. And there are folks within the health system working with some of you across the mission areas and our support areas to try to improve efficiency for our patients. How do we do that? You're going to hear about work already being done on unnecessary laboratory and radiology testing. Dr. La Posada, Dr. Walzer, and Dr. Rogers are going to be unrelenting about that, but in very focused ways that will get us the most benefit. Length of stay. I just gave you an example where orthopedics worked with us and avoided 29 patient days by reducing length of stay for their patients. And it wasn't easy. Look at all the things they did. They reviewed every readmission. They revised their order sets to address the issue. They did more risk assessments as a patient was admitted with care management. And they did more patient education and physical therapy. And that was the start to what will be, I'm sure, a longer and sustained reduction in length of stay. We're going to improve care management. David Marshall and others are working on this, reducing our 30-day readmissions so we avoid those no-pay penalties. We perform below the national benchmark in FY14, which the numbers lag behind by a couple of years, but we're looking at how are we also doing ourselves and measuring against ourselves, continuing to reduce the readmissions. We're going to reduce practice variation because we know that adds costs. So if you've worked on order sets or workflows or worked on getting those into Epic, that's all the work that's going to help us reduce practice variation. We need to reduce infections and preventable complications. And so, again, the focus on CLABSIs and CAUTIs and VAPs will help us be able to do that. So CLABSIs are central line infections, CAUTIs are urinary tract infections, and VAPs are ventilator-associated pneumonia. I just made it short so it would fit on here, but I wanted you to know I knew what it was. Because I memorized it right before I came over. Anyway, and we have to engage and contribute in order to be the very best. So the last leap I want to cover, but it's the most important leap, is the leap that we need to make with you. The leap that we need to make on being better leaders, leaders that you can count on or you can approach and say, this isn't going well. And we need to rely on you to do the jobs that we have carefully selected you to do. You're there for a reason because we need you and we need you to do that job. So if I look at it from the employee point of view, what do I need as an employee? Well, obviously I need to be paid, that's a good thing, and benefits and satisfaction with my job. I can have a well-paying job with terrific benefits, but if I have to drag myself out of bed every day, that's a tough job to have. So we need you energized. You want recognition. You want to be treated fairly. You want to understand what the expectations are. You want feedback on your performance. All these, every supervisor that's in this room and beyond, we need to make sure that we're doing that. What do I give as an employee? Well, I give input on decisions that affect my work. I don't sit there, listen to what's going to happen, don't participate in its design, walk out of the room, and start grumbling. You know, we need to give those decisions that affect your work. When you're given that opportunity, we need you to speak up and tell us what will work. It doesn't mean we are always going to, everybody decide that's the best way, but you need to be heard and you need to say that so we come to the best decision. You want feedback on your goals and career aspirations. We want you to tell us, what are those aspirations? How do you think you are doing? And then we need you to support organizational initiatives. We know how busy everybody is, but helping us to also focus on some of these things I talked about we need to do in Quantum Leaps, we will need your input. You also want to feel like you belong, that you belong here because of the mission, vision, and values, and so many of you tell me how much you resonate with that, and it is evident in your work. But also you want to be included, be part of the group with your coworkers and your supervisor. You want to feel that you belong where you are, and we understand that, and hopefully can help slot you into positions that are the right ones just for you. And then you want to know how you can grow. You should be able to expect, what's my future? That's why Dr. Callender really started last year emphasizing my road ahead. It's really, speaking from me to you, your road ahead. You need to help your supervisor, help yourself by sitting down and really thinking through, where do I want to be in 3 years, 5 years, and what do I need to get there so that I can have sort of the future that I'm dreaming of, and hopefully it can be at UTMB. So in investing in our future, we have lots of things that go into performance, benefits and comp, our perks and recognition, and our development. And I'm not going to read all of those. You're perfectly capable of reading. But many of these things we know are important to you. If there are other things that are important, let's think about what those are. And I'm just going to pick one example. People have talked about tuition reimbursement and said some places have more. You know, could we have more? Well, we're looking at how that's possible and doing it within the constraints of the finances that we have. But we've spent considerable time working through that and thinking, how could that look? What would that be? And that's a huge investment in you, particularly when you're training to be something that is along the lines of positions we're going to need. So we really are thinking we want to hear from you more how we're doing in that, whether it's emails or when we do the employee engagement survey. Some later this year, and others have done some surveys that we're working on and going to roll out. Some of the actions we'll take as a result of your participation in the AHRQ survey, and there's a nursing survey that's done every year for Magnet. But we must have a great work environment that engages you to want to be the best. So in summary, we have to stay focused to be the best in quality. We have to collaborate and be personally accountable for the service we give to patients and our transparency with them. We have to relentlessly focus and engage on efficiency. We cannot let up on that. At the same time, we preserve or enhance quality, and we all know that that's actually works, that combination works well. And we have to create a great environment that engages employees and faculty to be the best, because that really is our vision. We had a fabulous year in terms of the things that have happened. I couldn't begin to thank everybody, whether you're in this room or on the watching on your computers. I cannot begin to tell you, there is no way this could not have been done without the work of so many people. You're probably looking at, Joint Commission survey. We've had the makerspace for innovations in our work environment. We've had the dedication of the Jenny Seeley Hospital. It's almost done. I ran into some of the guys from facilities on my way over, and they were problem solving something. And I said, I want to thank you all for working so hard. And they said, oh, this is great. This is so great that we're going to finally be able to move our patients, and we're going to make that April 9th date. I mean, they're working hard to make sure that we are meeting our goals. And we've got the League City campus. It's on track for a June opening. We did a lot of work at Angleton with the Epic Go Live. I mean, I think about all the things that we have done since last March, and it's staggering. And it's also very evident that we have committed people who are really committed to UTMB and to the work that you do. And we are all very appreciative of that. So with that, I'm going to open for a few questions, and then I just need a couple minutes at the end to wrap up. So any questions?
We got a couple questions through EAC and Weekly Relays.
Yeah.
One of them is, what are we going to do about the Memorial Herman building across the street from us on I-45?
Yeah, we're Was anybody surprised when they read that? It's close, isn't it? We have been actually talking to Memorial Hermann about how we can best work together in that market. And I think that there are things that are going to be very collaborative, very doable, where we can work with them. So instead of repeating what's already there, we leverage the best of what is there and what they can bring. One of the great things about Memorial Hermann is that they have really, are pretty far ahead, at least compared to us, in accountable care and population health management, which Ms. Sadro talked about in her Mondays in March. And so that having a relationship with them actually could be extremely helpful to us. Being in their managed care contracting system would be extremely helpful. Becky Korenick's back there, and she's spending hours on thinking that through. But we also have, what do we have in that market that they don't have? Begins with a D or a P. Doctors. You know, so there may be ways that we can be helpful in that particular market. So we look at this as an opportunity to try to find ways to work together and leverage the best of both organizations. Anything else? I just can't believe nobody has a question. One more.
Well, if no one else does. This one has to do with MD Anderson. What is happening with the MD Anderson Cancer Center project? Are we merging?
Well, number one, we are not merging. We're both still going to be our own, we'll maintain our own identities. So UTMB and UTMD Anderson Cancer Center have one big thing in common, and we're part of the UT system. I think that as we think about being part of the UT system, we want to, again, leverage the best of both to reduce redundancy and maximize the investment that the UT system has in this particular area. We know that there are many, it's one of the fastest growing areas in Texas in that League City market. We also know MD Anderson is doing some regional cancer centers, expanding on that, and they were going to come to the League City market. So what made sense was finding out how we can best work together in order to provide exceptional leading-edge care for patients who have a diagnosis of cancer, while at the same time still continuing to leverage our own strengths as UTMB and as MD Anderson. So we're not merging, but we are going to work awfully closely together to, again, make the care the best that it can be for patients and access to that care in that market greater. And we do feel confident that that will be part of what happens as we move this along. They're planning on opening their cancer center building in December or January-ish timeframe of 2017, 2018. So we're working now on starting to work on the operating agreement that says how we're going to work together, how we're going to handle certain things like patient registration and where patients go if they, if they show up at the emergency room, or how do we handle the inpatient admissions. The benefit for us in that market, well, they'll have outpatient center. We're going to have 10,000 square feet of space, clinic space in the building they will construct. It will be for our oncologists. So some of that oncology care will occur in that building, which makes a lot of sense. But when the patient goes to the emergency department, is admitted in that market, needs certain kinds of tests, needs access to physicians other than oncologists, they will be our physicians, our resources. Their surgeons who will do surgery will use our operating rooms at League City. So we really think this is a win of using each other's resources to the maximal benefit. Mark, can you come up here for a minute? And he's like, what is she doing? You know what Mark does really, really well?
Turn red?
He sings really, really well. Now, what I'm about to do, if it turns out that it was a good idea, it was all mine, and if it crashes and burns, it's Sheila Lidstone's fault. But today is Dr. Callender's birthday, and we want to wish him a happy birthday. So, Mark, will you start us out in singing happy birthday?
Everybody chime in. Happy birthday to you. Happy birthday to you. Happy birthday, Dr. Callender. Happy birthday to you.
Thanks for being a good sport. Thanks to all of you for listening. Thanks for everything you do. Each day and every day, I can't tell you how grateful I feel to be working with people like you. I've spent many, many years in healthcare, over 40 now, which is a little frightening. And I have to say, this is by far it is the best place I've worked. You all make my job, you know, when I said you want to come to work every day, that's what I get out of this job, because I get to work with people like you. So thank you from the bottom of my heart, from all of health system and all of our entire institutional leadership, for the work you do every day to make a difference in our patients' lives. We really appreciate it. So have a great afternoon.
UTMB Health, working together to work wonders.